today we'll be discussing about vocal nodules. What are vocal nodules? They are non-neoplastic structural disorder of the vocal fold. Vocal nodules are also known as singer's nodules or screamer's nodules because it occurs in singers and screamers, etc. What causes vocal nodule? It is said that the voice abuse more than voice overuse. Voice abuse means not properly using the voice. That is, the person is talking in abnormally high intensities. The person is talking continuously in high intensities with surrounding background noise. Forced voice production due to strain in the neck and shoulder, etc. Repeated shouting, singing above one's own normal voice ranges, and also some people have repeated cough, repeated throat clearing. All this can cause vocal trauma that can lead to development of the vocal nodules. At this point of time, I would like to remember my ENT professor. So when he came to class teaching vocal nodule, he gave an example of a patient. So he had a patient who comes to his OPD and says, I have this hoarseness of voice and he's having vocal nodule. And when he examined, he's talking normally, only he's using his voice normally. Everything was fine. And my sir was saying, what is his problem? What is the reason why he's developing the vocal nodule? When he's in the OPD, he got a phone call. The patient got a phone call and he immediately attended the call and talked like, hello, I will talk to the client and I will make it, the deal will be done today. So he is using this false voice to bring out the majestic feelings of his profession or something. He's a dealer, some advocate and all that. This kind of low tone also can produce a development of vocal nodule. This unnatural low tone for prolonged periods of time can also cause development of a vocal nodule. Who gets this vocal nodules? In children, usually it is more common in boys than in girls. In adults, vocal nodules are more commonly found in women than in men. And also vocal nodules are common in people who depend on the voice for their profession, like preachers, singers, pop singers, teachers, street vendors, advocates, etc. Professional singers usually get proper voice therapy and professional help in their voice use. If you are a singer, you have to get that done. Otherwise, you are prone to develop a vocal nodule. Other causes are certain psychological factors, which again leads to misuse of the voice, and certain allergy and certain extraesophageal reflux causing trauma to the vocal fold. What happens when there is vocal abuse or vocal misuse? There is trauma to the vocal fold, which causes edema and hemorrhage in the submucosal space that undergoes hyalinization and fibrosis. The underlying epithelium undergoes hyperplasia or thickening with associated inflammation. What is the patient present with? The patient present with change in voice, hoarseness of voice, and the patient will say that I am having husky or breathy voice, which worsens when I use the voice for a prolonged period of time. The patient can complain of laryngeal discomfort, sore throat. When after talking for some time, patient develops sore throat. On talking with the patient, we can understand that the voice may be deeper in pitch and the patient talks with associated voice breaks. The patient will say that particularly the voice break will occur at the higher end range of the voice. How do you identify vocal nodule? The vocal nodule appears as grayish white translucent lesions at the free edge of the vocal fold. It is usually bilateral and they occur at the junction of the anterior 1/3 and posterior 2/3. That is almost midway of the membranous part of the vocal cord. It is because this is the area of the maximum vibration during the phonation and hence it is predisposed to getting more traumatized. And it can appear smaller and more pointed usually in singers. If it is a superficial lesion, it is almost always bilateral vocal nodule. In certain cases, they may be associated with the microwebs at the anterior commission. Around 23% can have that. What is the simplest way to see a vocal nodule? The simplest way to see a vocal nodule is using a indirect laryngoscopy mirror. Most people does not do an ideal examination in the OPD nowadays. Ideal is the most easiest method. You can just see if there is any lesion on the vocal cord. Just put a mirror, you can see the lesion. And if it is there, you can go for further examination. Excellent views can be obtained by a experienced person doing an ideal, only that the anterior glottic area may not be properly visualized. And preliminary examination to confirm the presence of vocal nodule, ideal is enough. And then we can go for video laryngoscopy for further evaluation. We can do a flexible fiber optic video laryngoscopy or a rigid video laryngoscopy can be used. Next investigation is stroboscopy. Why we use stroboscopy? In a normal eye, we cannot see the mucosal fold vibration because the mucosal fold vibration is around 100 beats per second. The retina, our eyes can process only 5 beats per second of images. So we are not able to visualize a waveform with a normal mirror or a normal endoscopy. For that, we use a stroboscopy. And in the stroboscopy, we can see the mucosal fold wave pattern. In vocal nodules, you can get a hourglass shape with only the nodules making contact. Only the nodules making contact at the center. The vibratory pattern of the vocal cord is better assessed with a stroboscope. What all can you see assess using the stroboscope? The glottal closure pattern, the mucosal wave pattern, the lesion can be described, the vocal fold opening and closing can be seen, the supraglottic appearance, and also the symmetry of the arytenoids, that is the vocal process. All this can be assessed by a stroboscopy. You can also do a GRBAS score. What is the GRBAS score? The grade, roughness, breathiness, asthenia, and strain of the voice can be assessed using a GRBAS score. And also, if the patient is having other symptoms like allergy or gastroesophageal reflux, we have a reflex symptom index score to identify the amount of reflux the patient is having and the problems caused by the reflux and whether the patient has to be put on an anti-reflux medication. What is the treatment? The treatment is voice rest and voice therapy. Patient has to be counseled regarding lifestyle changes, vocal hygiene, and advised to use voice properly. Aggravating factors like allergies and gastroesophageal reflux, extraesophageal reflux has to be treated. And modification of lifestyle, like using a whistle or using a microphone, can be advised. And also, patient can have to hydrate, drink adequate amount of water, avoid smoking, alcohol, avoid too much spicy food. All this can be advised in lifestyle changes. In voice therapy, patient can be given voice exercises, correct posturing, laryngeal massages, general relaxation exercises. All this can be given so that the voice quality improves. It is like you do exercise for the body. We have to do exercises for the vocal cords so that the voice quality is improving, voice stamina is improving, and there is a better vocal resonance, better vocal flexibility, and there can be improvement in loudness and pitch on completing proper voice therapy and vocal cord exercises. If the patient is failing voice therapy and the patient is persistently symptomatic, you can go for a surgery for vocal nodule. We can do a phono-microlaryngeal surgery, and we precisely excise the vocal nodule without any damage or exposure to the vocal ligament. To see the layers of the vocal cord, I have done another video. You can revise it so that this will be easier for you. And speech therapy or voice therapy has to be given before the surgery and after the surgery, because after the surgery also, if the patient is misusing or voice abusing, then there is a chance of recurrence of vocal nodule. So proper counseling has to be given to the patient. What is the differential diagnosis of vocal nodule? If it is a gray white translucent lesion, it can be proper vocal nodule, true vocal nodules, physiological nodules, prenodular swellings, pseudocyst, vocal polyp, mucus retention cyst, epidermoid cyst, etc. How do you differentiate from a vocal polyp and a vocal nodule? The vocal nodules are usually less than 3 mm in diameter and they are bilateral. The vocal polyps are more than 3 mm in diameter and they are usually unilateral. And this happens suddenly due to sudden vocal trauma, there is hemorrhage into the vocal cord, causing the vocal cord polyp. This is usually seen in men than in women and usually seen in smokers. So smoking predisposes to development of vocal cord polyps. Cigarette smoking will cause injury to the vocal cord, leading to hyaline degeneration in the polyps. There is disruption of the vascular basement membrane. There is capillary proliferation and thrombosis and hyaline degeneration. All these are augmented by smoking. Sometimes in patients with vocal cord polyp on one side, a sulcus or a mucosal bridge or an intercordal cyst is in the other vocal cord. It is also postulated that one vocal cord got affected, and because of the improper vibration or incongruency in both the vocal cords, the other vocal cord got traumatized and the vocal polyp has developed. And the patient's complaint, the voice quality depends upon the mass effect on the vibration and also on the vocal cord closure, and also secondary compensatory mechanism that the patient has developed, like tensing of the muscle, like secondary muscle tension. That also will affect the voice quality of the patient. The vocal cord polyp can also be pedunculated, so it can move in and out while breathing. The patient can complain of the same hoarseness of voice, a breathy voice. Patient can complain of double voice, low pitch, and the patient will complain that he has lost part of the voice range. Rarely large polyps which is moving up and down, pedunculated ones, that can cause breathing difficulty and choking. Treatment is for these patients also voice rest, smoking cessation, give management for allergy, give management for gastroesophageal reflux, and also voice therapy. More than vocal nodules, most of the vocal polyp might need an excision. Phonomicrolaryngeal surgery can be done and the vocal polyp can be excised, and we can restore the smooth edge of the vocal fold, allowing them to close fully and vibrate normally. Summarizing, vocal nodule, structural non-neoplastic benign lesion of the vocal cord, less than 3 mm in size, located at the junction between the anterior one-third and posterior two-third of the vocal fold. It is most commonly seen in voice abuse and also teachers, singers, preachers who abuse their voice. Treatment is voice rest and voice therapy, and sometimes excision is required. Vocal polyp, unilateral, seen in smokers, more common in men. Here also sudden voice abuse or sudden voice overuse. And treatment is voice therapy, voice rest, vocal hygiene, lifestyle modification, and also microlaryngeal excision.